Hi, I'm Dr. Steve Tucker, and we're going to have another episode about using GPT to help understand newly diagnosed cancer information. With me again is Evelyn from our content team. Evelyn is also a pharmacist, oncology pharmacist, and she helps me think of scenarios that may be helpful for our patients. Last time we talked about prostate cancer and we created a newly diagnosed patient, we gave him other medical problems, we talked about competitive mortality and brought in multiple specialists and created our own multidisciplinary tumor board to get information. Now, before we do the next case, this is really important. We wiped the GPT. So not because we're worried about the data, but we want GPT to act as a breast cancer specialist now. We don't want necessarily the urologist to be involved in the thinking about this or to be confused between prostate cancer and breast. So we've cleared GPT and we're starting fresh, and we can come back to the prostate one. Well, you can go back to a prostate scenario at any time because GPT saves that as a separate conversation. Did you know that?
Now I'm getting a better idea of it.
So this time we're going to make it all up. I'm not going to drag and drop any of the records or pathology in. That is definitely something you can do, and I encourage to have your labs, your scans, your pathology. You can just drag and drop into GPT and say, tell me what you think. But it's even better if you start with a scenario. So, and again, my favorite trick, I'm going to dictate to the computer. I want you to help me think about newly diagnosed early stage breast cancer, full stop. I want you to role play for me, full stop. Could you please be the clinic coordinator for a multidisciplinary breast cancer program, full stop? Who do you think we should have at the table when we do a multidisciplinary assessment? So instead of me thinking about who to invite, I've asked GPT to think of who to invite.
A lot of key persons that we should
Right. And so straight away it says a breast surgeon, an oncologist, a radiation oncologist, the radiologist, that's somebody looking at the scans, pathology, a genetic counselor, plastic surgeons, I like this, nurse navigator, nutrition, physical therapy, and a clinical trials coordinator, right?
Can you explain what the roles
Uh-huh.
of like this key person here?
They didn't invite you.
Oops,
Like,
pharmacist
when-
is not invited. That's a second.
You forgot to invite the pharmacist.
Thanks, Dr. Tucker.
Let's see. Hopefully it'll play. You're absolutely right. We're inviting the pharmacist. Great. Now, let's give it a case scenario. Here's the first case today. It's a 40-year-old woman with screen-detected breast cancer, and the tumor was found to be 2.1 centimeters in the right breast with a abnormal lymph node in the right armpit, full stop. Biopsy showed 19 millimeters of lobular carcinoma, and it's estrogen and progesterone positive, HER2/neu negative. What should be done next? So, given the information, surgical planning, consideration of preoperative chemotherapy, everyone's giving their opinion. I think for time, I'm going to jump ahead and say surgery's been done. And what I want to get to is the treatment being offered by the medical team standard of care? Living in Asia, I have a lot of patients who come from either rural destinations in various Asian countries, and they don't necessarily trust the information they're getting. And so they need validation. So I want to make sure that if you put the right information in, you're getting a reasonable bit of information out. I think that reassurance can be gained, and it certainly empowers the patient. So surgery's been done, and the patient underwent a complete mastectomy and sentinel lymph node dissection. The final pathology showed 21 millimeters of lobular carcinoma that was estrogen and progesterone positive, 3+, HER2/neu negative, full stop. No other markers were performed, full stop. And her sentinel lymph node dissection showed 1 of 4 sentinel lymph nodes with microscopic involvement, but nothing else. Based on this information, what is her stage? What is her group stage and her TNM stage? And what would be the standard recommendation for adjuvant therapy, both adjuvant chemotherapy and adjuvant endocrine therapy? Help the patients understand, should they take more medicine? Should they take chemotherapy, and what chemotherapy? Should they take hormone therapy, and for how long? And obviously, we really try to reduce our reliance on chemotherapy, but it does have a benefit in addition to hormones. So, it's important to put this together because it's all standardized. Watch the next trick we'll do. So it's given us the staging, T2, N1, M1, which is correct. It's stage 2A. And the recommendations are going to be common chemo and hormone therapy, and the durations, and the summary. It's right there. Now watch this. Are you familiar with the NCCN guidelines for breast cancer management? If you are, please make sure the recommendations you've given are consistent with those published guidelines. Please show your work. Please show your work is a really great trick. It keeps GPT focused, because sometimes it gets lazy, sometimes it gives you more than you want, but show your work lets it know that you're paying attention. So as we scroll through here, definitely it's talking about the NCC guidelines, it says it's all consistent. Would we like to review other guidelines? Does everyone at our tumor board agree with this recommendation? And yeah, I think because we went to guidelines first, everyone's in agreement.
Standard of care.
Yeah. I'm the medical oncologist now at the table, and the patient has told me she absolutely doesn't want to take chemotherapy. For personal reasons related to watching her friend get chemotherapy 20 years ago, she's deathly frightened of getting chemotherapy. Should I try to convince her to take chemotherapy? If she doesn't take chemotherapy, what risk is she taking? What's the absolute benefit of chemotherapy compared to chemotherapy followed by hormone therapy in this case?
This is exactly what a patient would commonly ask.
Yeah, I think I was a little bit wordy, but it's really important that we explain to patients in common terms that we know hormone therapy really works and reduces the risk of relapse. And we know chemotherapy really works and reduces the risk of relapse. It's not 1 + 1 = 2. It's definitely better to have both over one or the other, but the absolute benefits can be smaller. And what risk is she taking? Is it the absolute benefits here? They're saying the risk recurrence difference of about 10 to 15%. If she declines chemo, it might be a 5 to 10% reduction in the risk, and how to quantify the risk. So it gives both the doctor and the patient some framework for understanding what they're giving up. I think that it's important that people make these informed decisions. It's not our job to give you the chemo. It's our job to tell you it exists and that we recommend it, but most people are going to do well either way. So I think that once you know that the doctor's supportive of your informed decision, that actually alleviates you of a lot of stress, which also improves your health. Once we've started setting up this chat, all we have to do is make some slight variations. I want us to continue with the same case, but go back to the very beginning. It turns out that the patient is HER2 positive. HER2 is a marker for breast cancer that is more aggressive and signifies that we're going to use some additional medications. Given that the patient is HER2 3+ positive and positive by the technique known as FISH, F-I-S-H, would we start over completely differently? How would we treat this patient? Bring this to the tumor board, and what does everyone have to say? It's completely revised the treatment approach. And it's talking about preoperative chemotherapy and the benefits, and whether we should be, is everyone in agreement, and how to do that. Radiation therapy might be needed even though a mastectomy is going to be performed. The genetic counselor is not directly related. Patient's age still warrants consideration of genetic testing. Yeah, so you can make changes around all of this. I'm wondering if we should make another scenario, or instead, I need to understand this a little bit better to explain to my mother. My mother only graduated high school and doesn't have a lot of scientific jargon, and she's very anxious when it comes to health. Help me put this into some simple language so my mother understands that I'm going to get chemotherapy to prevent recurrence.
Now we're asking ChatGPT for very personalized explanation.
You know, asking it to be empathetic, asking it to give me some language that is humanistic and not technical. That way, I can feel better about how I talk to my mom about the case without compromising any of the actual information. Again, it's personas, because I have to tell GPT, my mom is an anxious person, my mom has a phobia around chemotherapy, I want to be optimistic and realistic. You can really put in all of those terms so that you get the kind of language that is going to be the most accurate but most well received for the audience you're speaking to. I mean, I think we could change it to, you know, say, I just want the facts and tell me quick answers. Tell me what to do, doc. The paternalistic view. Actually, that's curiosity. Let's see. I want you to act as a highly paternalistic medical oncologist. You don't like to answer any questions to your patients. You usually just give them a document and tell them to show up, full stop. What kind of statement would you make regarding the case above? This is your treatment plan. You'll be starting chemotherapy with medication for your cancer tomorrow. It needs to be done to reduce the risk of cancer coming back. You've got all the information in this document. Just follow the instructions and come to your appointment.
Whoa,
right?
That's so straightforward.
That is not the kind of doctor I ever wanted to be. But I'll tell you, there are a lot of patients who love that doctor. And it's really important to know your own voice as a patient and to understand that physicians have different voices. And it might not change the recommendation, because we're getting the same recommendations from the empathetic, shared decision-making doctor, as well as the paternalistic, Dr. God complex physician here. And some people, you just have to find the right, the right person it's like precision medicine, the right drug for the right person at the right time. I think there are precision conversations, the right word for the right human at the right time.
Great.
Any other questions for GPT, or should we let it rest?
For what other common questions that patients would ask you during your clinics that perhaps we can ask for some insights from ChatGPT?
Well, I think, sure. I think patients often ask questions about where did the cancer come from, which is always hard to explain. And they always ask about genetics.
But it will affect their children.
Right. So let's ask that, but I have another thought on genetics too. Hi, I'm the patient, and I really appreciated being a part of this tumor board, but I wasn't sure about the role of DNA and my cancer, full stop. I understand that we can measure my DNA for risk of future cancer or risk of hereditary cancer in my children, but I also heard about a DNA test that can be done to the tumor that might be able to help me decide whether chemotherapy is a benefit or not. Do you know what test I might have heard about? So what I alluded to was a test called Oncotype DX, which is a test that we do on the tumor because it helps us decide whether chemotherapy is truly beneficial at a personalized level. And so as we'll go through the script here, we talk more about the inherited risk and whether the children are at risk, but the tumor testing assay, Oncotype, is a score that predicts whether or not chemotherapy may or may not be necessary. Tell me more about the germline DNA and how I could find out if I have an inherited cancer gene. I also heard about multi-gene panels. What is that?
That's cool for a patient because rather than Googling everything by their own, they can just use one device and then get everything sorted out.
And it remembers. I think that Google is great and Google serves a purpose, but this is a personalized search. And if you're ever in doubt, because GPT makes mistakes, and like we said before, we're not letting GPT replace the doctor. This is a tool to enhance education, improve empowerment, and make your limited time with your physicians more effective. But if you don't trust GPT, you can definitely come back to it and say,